Yes, I'm actually a GP registrar. Before that, I was an ENT trainee. I carry on with ENT-related research, and so this is just talking about people with olfactory disturbance. So we know that olfactory disorders affect a significant proportion of the population. It's very difficult to put a figure on it, but we think it could be up to 49%. It's something that increases with advancing age, and it can be related to an ENT problem or a systemic disorder. It's logical to assume that these people are at increased risk of physical and psychological harm, and there's little consensus on management. And I really mean that more in the sense that people who present to their GP may be managed very differently, and people who present to ENT, people who don't have a particular interest in, are also managed very differently. And has traditionally been little support for patients if you compare to something like loss of hearing or loss of sight. So the Smell and Taste Clinic was started by Carl Philpott at the James Paget Hospital in 2010. At the time, it was one of very few smell and taste clinics operating. And very soon after this, the charity Fifth Sense was launched. This was launched by a patient attending the clinic who was very passionate about the cause. And surrounding the launch of the clinic and the launch of the charity, there was quite a lot of press regionally. And following this, the clinic was inundated with emails, telephone calls, inquiring about the clinic, and we kind of realised that the need for the clinic was even greater than had been anticipated. And that pointed us towards doing some more research to more formally assess the requirements of these patients. So the primary aim was really just to get some key themes about what the most important things for these patients were, to target research and service development towards these needs, and to explore the educational needs for clinicians when managing these kinds of patients. So the formal study was called the Patient Accounts of Anosmia Study. Patients were approached who had contacted the clinic either by email, by letter or telephone call, and also those who attended the clinic during the study period. And it was any patient who had suffered a quantitative loss of smell or a distortion in their sense of smell. And obviously for those patients who didn't attend the clinic, this is just a self-reported phenomenon. At the same time, I was already doing a qualitative study looking at people with chronic sinus disease, and the majority of those patients interviewed, they were all asked about their sense of smell, and the majority had quite strong feelings about it, so we included this data into the qualitative analysis as well. So we had 92 participants in total, 71 gave written accounts, and the other 21 were interviewees. And we had males and females, a spectrum of ages. There were a spectrum of patients interviewed with different kinds of CRS, and obviously those who wrote to us, we don't have a diagnosis for why they had a disordered sense of smell. The main themes that came out from the study were impact on diet, physical health, hygiene, an emotional impact, effect on interpersonal relationships, a financial impact, and also a lack of understanding of health professionals. So I'm just going to talk about some of these in a little bit more detail. For physical health, appetite, diet and weight, most people reported that these were affected, which you can understand, but the direction in which they're affected varied dramatically. So some people just lost their appetite, things didn't taste the same, they didn't want to eat, they lost weight. Other people found that because they could taste either salty foods or sweet foods, their diet was actually very poor because they were focusing on those things that they could still taste. People talked about difficulties with hazard perception, which is perhaps the most obvious thing. And we had a few patients who'd had actual fires, and certainly lots of people commenting about not wanting to use gas to cook because they were worried they wouldn't smell it, and those kinds of things. For the social impact, there were obviously a lot of occupations that were affected, and in particular we had people who were social workers who found they couldn't properly assess people's houses to detect damp and those kinds of things. Obviously we had a chef and aromatherapist, which is critical to their career, and a lot of parents who found it was difficult. They didn't like to go out in public with their babies because they weren't sure what, if the nappy needed changing, and also an impact on the bonding with the child. People often described a kind of emptiness, like they'd lost a dimension in their life, and these are just a few quotes. People saying they're feeling sad and depressed. I've already mentioned the bonding with babies, but that seemed to come up quite significantly. And people who found that their relationships changed because the person didn't smell right to them anymore. A lot of people talked about memories and finding it difficult to access memories, because you know yourselves, if you smell something, it can take you very quickly back to a place or a person. So they described kind of a loss of that ability. Most people had a mixed view of professionals. The reason I've just put the negatives here is because the positives tended to be people who were interested, so the smell and taste clinic or a rhinologist. But most people seemed to be fairly unsympathetic, and there was kind of an attitude that it wasn't as bad as losing your sight or hearing, so you should just get on with it. So in conclusion, it's a very large qualitative study allowing people to express in their own words the impact their symptoms had on them. It was overwhelmingly negative, and I think it's important to kind of just reflect on what an impact it can have, particularly if we're frustrated that we can't find a single diagnosis. It doesn't mean the patient isn't suffering. It seemed to be poorly understood by people's friends, family and colleagues, and hopefully the Fifth Sense charity will help to address that kind of the public perception of the symptoms. Future work. So all of those impacts, we know that people with dementia and Parkinson's, and as you get older, lose your sense of smell. And all of those things like diet and accessing memory, if the sense of smell is impacting on those, we could have quite a big effect by addressing it. Which brings us to the need for further research into potential treatments and ways of managing disordered sense of smell. I'd just like to thank Tim Bradshaw, who coordinated the collection of data for the PAS study, Duncan Boak, who is the founder of Fifth Sense, and Carl Philpott, who's been my supervisor. Thank you.